Hello, Facebook family. Thank you for joining me today. Today we are going to learn uh, what group are at increased risk for suicide, which age group is experiencing the most increase in anxiety and depression, which often leads to increased suicide, and we're going to learn strategies for managing our depression and our anxiety. For those of you all who are listening, that's what we're going to learn. But we're going to give people about 10 minutes to hop back on. So if you're listening to this in the replay, I would encourage you to go to roughly the 10-minute mark. You go to the 10-minute mark. If you're listening to this in the replay, go to the 10-minute mark, because for the next 8 to 9 minutes, we're just going to welcome people, say hello, give people a chance to hop on. But again, today you're going to learn about COVID and depression and anxiety, but mainly COVID and mental health. And you're going to learn the three groups that are at increased risk of suicide. The main group that is at increased risk of suicide, the group that is most responsible for the rising cases of depression and anxiety. And we're going to learn a few strategies for how to help us get through this. If you could put in the chat, for those of you all who are listening, tell me where you're listening from. Tell me where you are listening from. For those of you all who don't know me, I'm Dr. Geoffrey, a crisis and split-second decisions expert. What I do is I go around the country and I teach executives, I teach teams how to manage crisis and how to make split-second decisions. As a result of COVID, I find myself as well as talking to many communities and updating them about COVID. I stay on top of the current of the COVID literature, mainly because there's some Fortune 500 companies that actually have me live into their employees regularly. But thank you all very much for joining me. And again, I ask you to put in the chat, where are you listening from? Where are you listening from? And keep in mind, the world has changed a great deal since the last time that we talked. These variants are changing greatly, and don't be shocked. They will continue to change. Technically, there are 4 main variants that we are talking about, but there have been documented about 46 different mutations so far, 46 different mutations. But the main ones that we keep hearing about are the South African one, the Brazil, the United Kingdom, as well as the California one. And those 4 just so happen, if we looked at them as a group, it's true there are different nuances to them, but by and large, those ones are more contagious. And unfortunately, it's showing that they're more lethal. But thank you for joining me on Medical Monday. Again, Medical Monday. While we're waiting for a few other people to hop in there, let me just answer a few questions that were already submitted in advance. They wanted to know about the newest symptoms. Well, with the new variants, the symptoms are about the same, except the symptoms are more severe: increased fevers, increased coughing. So the symptoms are about the same. But with the new strains, they're less likely to have loss of taste, loss of sensation. But the newest literature is also showing, and this is where we will connect dots. In those first 5 days, the more number of symptoms you have, it tells us 2 things. The more number of symptoms that you have, the more likely you are to develop long haul or long time symptoms. Long haul symptoms are basically once your body clears itself of the virus, meaning that you are no longer contagious, you still experience symptoms. And number 2 is what it's telling us is that the more number of symptoms you have in those first 5 days, the more increased risk you are of needing to be hospitalized. And we have to combine that with the fact that the more number of risk factors you have, and the more number of symptoms in those first 5 days, the more likely you are needing to be hospitalized. And so let me just tell you the most common symptoms. And I'm still waiting for a few people. Tell me, put in the chat, tell me where you're listening from. The most common symptoms, and these are the symptoms, don't necessarily write them down, although I will go slow. The triad that we already knew about are loss of taste, temperature, a fever, and as well as a cough. The other symptoms to be on the lookout for are a headache, non-specific headache, abdominal pain, diarrhea, chest pain, sore throat, muscle pains, confusion, abdominal pain, and skin rash. Those are, and anorexia, meaning the loss of, you don't feel like you want to eat. Anorexia, you don't feel like you want to eat. Loss of appetite. Now, we got Nicolette. Hey, Nicolette from McDonough, Georgia. We have Miss Tina Joseph in Houston, Texas. And again, about the 10-minute mark, we're going to get to rolling with anxiety and depression. For those of you all who joined us yesterday when we talked about this, and we had an expert on with us, Dr. Angela Kinslow. I thank you very, very, very much. As you know, we had a few technical problems for those people who tried to jump on yesterday, which is why we're doing this again. Just so happen we don't have the Today Show host, our frequent guest from the Today Show, Dr. Angela Kinslow. She will not be joining us today. While we're still waiting to get to the 10-minute mark, the reason why it's so important to recognize your symptoms and to keep track for the number of symptoms you have, especially in those first 5 days, is because if you notice if you have one symptom, chances are that you're probably not going to progress to needing to go to the hospital. But if you have several other symptoms, you should be more vigilant about deciding if you need to go to the hospital. The most common reason for needing to be hospitalized or needing to go to the ER is increasing shortness of breath, or worsening shortness of breath. There are many others, but those are the most common ones. The need to go to the ER, according to the CDC, is again increasing chest pain, sudden confusion, bluish lips. Increasing chest pain, sudden confusion, bluish lips, and confusion. Those are absolute needs to go to the hospital. And again, it's not limited to those, but those are the most common reasons. And just some general advice, given that, now follow me on this, I'm not trying to scare anyone. Given that these new strains are more contagious, which means it's easier for us to contract, and they're about 30% more lethal. The reality of it is, you, me, it's very likely that someone that we know or even a loved one may contract COVID. And if that happens, just keep in mind that 97% of people, that number has not changed, tend to go on and do just fine. And most of and you're usually home treating. But you should be prepared, and your loved ones or people you know should be prepared. I mean, you should already have a thermometer at home. You can choose to get a pulse oximetry, also known as a pulse ox. That's a little device that you can purchase on Amazon. They have some there for as little as $12. What that does is it measures the oxygen saturation in your heart, and some of them measure your heart rate as well. If you can measure your oxygen saturation, and you can just put it on your finger and it stays in the 97, 98, 90, 99 percentile, it means that your oxygen's pretty good. If you notice that it drops down to below 92, 91, then that's a level that you probably want to go to the ER. But by the way, nothing I say should be taken as medical advice. This is just for information purposes only. But again, some items you want in your house now is a thermometer, and you want a pulse ox. I would also encourage you to make sure you have the typical over-the-counter flu-like symptoms. I mean, the over-the-counter cold medicines. And as I've talked about for many months now, vitamin D has been shown to be very helpful. It's only helpful if you're vitamin D deficient. If you're vitamin D normal, vitamin D is not helpful. I am not saying that vitamin D is a cure, but what I am saying is that the data is very clear. People who contract COVID who are vitamin D deficient tend to do worse. As well as I was encouraging you to get zinc and melatonin as well. There are some hospitals that are also giving vitamin C and vitamin B. But everyone, we are into a critical phase. And right now, this is the fourth quarter. Last thing we want for those people who have not contracted COVID, you made it this far. We're almost there. We want to do our best not to contract COVID. For those people who have COVID and have survived, congratulations. And for those people who have lost loved ones and friends due to COVID, I'm very sorry to hear that. But what we do know now is that those of us who are here have to play our part and do our best to survive. Now, we're going to get we are at the 10-minute mark. We're going to talk about anxiety. We're going to talk about COVID and mental health. COVID and mental health. And just to be clear, I am not a mental health expert. I'm a board certified emergency medicine physician. I practice on the front lines and I see COVID. What I say today or any other day that you see me is for information purposes only. It's not medical advice. I would encourage you to always consult your primary care doctor. Today, you're going to learn what age group is at increased risk for suicide. We're going to learn what age group is the most vulnerable for increased depression and anxiety. And we're going to come away with a few strategies. Hey, what's up, Sandra Perry? Thank you for joining us as well. Now, those people who do develop COVID or who have contracted COVID, you are at a 20% increased risk of developing post-traumatic stress, OCD, obsessive compulsive disorder, anxiety, and depression. The study showing that the further amount of time that passes since you have COVID, those symptoms often decrease. If you have any doubt, I would also encourage you to talk to your primary care doctor and seek medical help. According to a Boston University study, as well as a Johns Hopkins study, the number of mental health issues as it relates to like COVID is tripling. It is tripling. Those people with pre-existing mental health conditions are at increased risk as well. Those who live alone are at increased risk as well. And just so happened, not sure why, did not read it, but Asians are 5 times more likely to experience increased anxiety and increased depression. Now, to the question, what age group is experiencing the most amount of depression and anxiety? Here it is, in a recent report, 62% of those ages 18 to 24 are likely experiencing depression or anxiety. 62% of those between the ages of 18 to 24 are more likely to experience, are experiencing anxiety and depression. Whereas those in the 25 to 44 age group are about 30% more likely to experience anxiety and depression. And the good news is that those over the age of 65 have, since the beginning of this pandemic, they have experiencing decreases the amount of anxiety and depression. I'm not saying that it's not there, but their numbers are going down, which is a great thing. And for those of you who are over the age of 65 and you're still experiencing anxiety and depression, notice I did not say it did not exist. I'm just saying that in terms of the total numbers, it's changed. Back in June, the bulk of the increased anxiety and depression were in the 65-year-old age group. Let's talk about the 18 to 24-year-old group. That's the second thing that we will learn tonight. This is the group that's experiencing the most, who's experiencing the most number of increase in suicide rates or suicide attempt rates. You say, well, why is the 18 to 24-year-old group, why are they experiencing the increased suicides, increase in depression and anxiety? Truth is, no one really knows. But some common thinking is, as it relates to major life milestones, this group has been impacted the most. Why? Because you've got seniors in this group, meaning seniors who are graduating from high school. They're missing their proms. They're missing their graduation. They're missing all the celebration that goes on with their senior year, as well as college graduates. They're missing their graduations. They're missing all the celebrations that go along with being a college senior. All the parties, all the downtime, all the pledging. They're missing that. and many of them are not even able to like find jobs. So it kind of makes sense why this group is experiencing increased anxiety and depression. Don't get me wrong, because in the live yesterday, someone commented, I'm not saying that we're not all impacted, but in the traditional concrete milestones, graduations and proms and graduating events, this group is most impacted. And then also you have college students that are in this group. And if we're honest with ourselves, when you were in college, whether you're a freshman, sophomore, junior, or senior, the last thing you want to do is be home with your parents for an extra year. Hence, it really makes sense why it's so important for us to just keep an eye out on this group. Check in with them as well. Now, as Dr. Angela Kinzo, the post-traumatic stress clinical psychologist recommended yesterday, there are a few things that we can do to help ease this anxiety and depression. One of them is develop a daily routine. Develop a daily routine that you stick to. And that routine should be centered around making your life as normal as possible. Getting up, setting the alarm, getting dressed, making sure you eat your meals at the same time. And in addition, it's nice that a couple days a week, you plan some activity that you're looking forward to. Dr. Kinzo laughed at me yesterday when I said, hey, plan going to the grocery store can be something you look forward to. For me, that I look forward to going to the grocery store. Why? I get a chance to get out the house. You go get your snacks. So that's an activity that I look forward to. So have a routine that's as normal as possible. You're getting up at the same time. You're setting the alarm. You're getting dressed. You're sitting down to let's study. It is planned, but in that, plan some activities that are fun. While we are quarantined, there's a fatigue that's happening. So maybe an activity can be, hey, I'm going to meet my friend out at the park. We're going to mask up. We're going to keep our 6 to 12 feet distance, and we will be able to communicate that way. Increasing your amount of Zoom calls, staying in social contact, contact is very, 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 very helpful as well. And then make sure you stay busy, but busy with something significant, not busy sake. I would encourage many people, maybe this is your time to write your manuscript. Maybe this is your time to write your book. Maybe this is your time to start to research whatever your social justice cause is. But an idle mind is what we're fighting against. And parents, number 4 is that parents check in on our young folks, check in on everyone. As you've heard me talk about in many of my lives, it's very important for us to check in on one another. But now that we're armed with this new data that our 18 to 24-year-olds may want to check in on them just a little bit more. And I have an 18-year-old. I get it. You check in on them, they're almost offended. But hey, we are in COVID. We're all in this together. So we're doing what we can to make sure that at the end of this, and by the way, I see that coming soon. At the end of this, we're all here. And I'll be honest with you, my personal goal is to make sure that when this is over, I'm someplace better. I've grown somehow, making sure I read a certain number of books each month and so forth. Hey, today was a light live, and that was the purpose. Now, I will open it up to questions. Thank you very much. But yes, someone put in there, be productive. Oh, I love that. Tamara says, have a purpose. And it doesn't have to be you're going to save the world. Have a purpose that's meaningful to you. Have a purpose that's meaningful to you. And everybody, there's a lot of online mentoring programs that are being developed. 18 to 24-year-olds, there are a lot of young kids who need mentoring. They need tutoring. Join many of those programs as well. Now let's take a few questions here. Thank you for this topic again today. Yes, I was just on call with my son discussing this topic. Thank you, Perry. Make sure you talk to your kids about this. This is a very, Very, very real subject. And I can just tell you, still practicing in the ER during COVID, I am seeing an increased number of people overall, but also an increased number of young people who are coming to the ER for psychiatric reasons. And these are people. I didn't keep count, but it does stand out that that many of these patients have never had any psychiatric issues in the past. Hey, this is a crisis that the world has never seen. If you're experiencing a little anxiety and depression, it's okay. Don't be too hard on yourself. What's most important is that we manage it. We maneuver through it. We figure it out together. Hey, if you have any questions, please reach out right now. Otherwise, we're going to move here. I have one other point before we end this here. As it relates to the new strains, I told you that there was 4. I mean, while there's been 46 documented, there are 4 that are most common in this country now. It's one in California, also known as the Cal 20C. The one from the UK is the B1117. And South Africa is a B135, and the Brazilian one is P1. Let's be clear. These are more contagious. And from a very practical point of view, it means that our mitigation and our prevention strategies must be even more. We must step them up. Dr. Fauci himself has even recommended to double mask, especially if you have one of those cheap masks. I also recommend increasing the social distancing from 6 feet to 12 feet, which is not unreasonable. Keep in mind, 6 feet distance was a minimum distance. It's a minimum distance if you're talking about being close to someone who may have or who has active COVID. And then going out, if you going out less, going out half the amount of time. These new strains are 55% more contagious. Go out less. That decreases the likelihood of you contracting COVID. And I told you, most of what I tell you comes from evidence-based peer-reviewed journals. Dr. Fauci, a listserv that I'm on with other physicians of the WHO. What I'm about to tell you right now does not come from that. It does not come from any academic peer-reviewed journal. It comes from me reading the literature that comes out of China, and also a new study, which I have not read, but I've heard about. Out of San Pablo, out of the University of San Pablo. I'm recommending that people also use mouthwash. Rinse your mouth every time you've been out and come in, or rinse your mouth when you get to your destination. For instance, if you're going to work, rinse your mouth. The general feeling is that, in China. So in China yesterday, they had 87 cases. We had several thousand cases. They wear masks, they socially distance, but they've consistently used mouthwash as well. The thinking is, and follow me, that most of the COVID virus comes through our mouth. And what determines if we contract COVID is the viral load that's presented to us, the viral load that's presented to our lungs, where it first goes in our mouth. If you can rinse it out, if you can gargle with a mouthwash, the feeling is it decreases the viral load. In fact, the University of San Pablo says, hey, even if you don't have a mouthwash, and by the way, they have developed a commercial mouthwash, even if you don't have a mouthwash, their feeling is just rinsing your mouth with regular water. Regular water will decrease the mouth load. I mean, will decrease the viral load in your mouth if somehow you contracted COVID in your mouth. And they use Vietnam as a great example. Now, I'm making leaps here. I'm going to tell you that just up front. There are 96 million people in Vietnam, yet they've only had about 2,000 COVID cases and only 35,000 deaths. They wear masks, they socially distance, but they also use mouthwash a whole lot. I would encourage you, again, this is not evidence-based. I would encourage you, from a risk-benefit point of view, there's minimum risk in rinsing your mouth out. And in case we find out that it's helpful, hey, it has gotten us further along that curve. That's all I have for you. Takesha Ford, hey, thank you for joining us tonight. Thank you to Takesha. Takesha asks, does the new strain has less effect on persons regardless of age group? That's a great question. And the answer is that the newer strain is more lethal. It is true that the older you are, the more at risk you are. So for every year, you're at greater risk. But what we're finding is that the newer strains are impacting the younger people more. They're impacting the younger people more and thus making them sicker. I'm not saying that with the younger people that they're leading to increased death. That data is not out, but the data is out there that is 30% more lethal. But what is clear is that it's causing more young people to be hospitalized. More young people to be hospitalized. You should share with your young folks, while originally the medical community and the media build this as, hey, young folks are safe. They get a little sick, a few flu-like symptoms, and then they're just fine. That's changed. We're finding that they're getting sicker, that they're being hospitalized, but they're also at increase. But they can also be long haulers, which again, that we already talked about. You contracted COVID, you've cleared active COVID from your body, but you still have symptoms, meaning you can still experience brain fog. You always feel cloudy. You're short of breath. You may experience shortness of breath for a while. There are many examples of marathon runners who now are barely able to walk up and down the street. The loss of taste and sensation, while it's less in the new strain, it's staying around longer. Those are all long haul symptoms. Increased diarrhea for a period of time is a long haul symptom. Increased fatigue, it's a long haul symptom. I would encourage you to reframe this with many of your kids as well. It's not benign to the young folks, which is how we first built it at first. Hopefully that answers your question, Tina. And Tina said, yeah, I meant greater or lesser. I think that answered your question, right? If you could just comment real quick before we sign off. And then the other part, while I'm waiting for Tina to comment, is, hey, that's it. Yeah, the increase, the greater load that you are exposed to, the sicker you are. The more virus that you're exposed to, the larger the concentration, the more likely you are to contract COVID, but then also the more likely you are to be, the more sicker you will be as well. Hey, this is Dr. Geoffrey. We're all trying to make it, and I get it. You're getting tired, but this is the Super Bowl just ended. Look at it this way. You're in the fourth quarter. You're in the fourth quarter. You made it this far. This is not the time to let up. The vaccines are here, and they're currently working. They're definitely decreasing transmissions. And if we have to develop another vaccine, or if we have to be vaccinated more, it is what it is. But right now, our goal is to manage through this and come on the other end of this much better off. And there's Takesha's question there. There was a woman in Missouri who recently charged with medical fraud, stating that stem cells were a cure to combat COVID-19. What are your thoughts about that? I have not read that in my reporting that stem cells are a cure for the COVID vaccine. And that's also outside my area of expertise. I'm not a virologist or an immunologist, and that's what stem cells are. They are call them precursor cells before they reach. They're the baby cells. They're the immature cells. So that's outside my area of expertise. But I have not read that as well. And just so you know, even if it is true, what I do know is stem cell transfusion and stem cell development is highly complicated, and it's not simple. It would not be, I can say this with the utmost confidence, it would not be available to the overall community as a whole, to the overall citizenry overall. Hopefully that was helpful, everyone. And you know what I'm getting ready to ask. Make sure that you contact one person tonight before you go to bed. to say, hey, I'm tired. It's the end of the night. It's 8:30. I'm calling just to check on you, to find out how you are doing, because each one, teach one, help one, and pass along, and we will all get through this together. Do me a favor. Be sure to follow me on my YouTube channel at Dr. Geoffrey. And that's wrong. YouTube/Dr. That's Dr. Geoffrey, Geoffrey. I'll talk to you soon. Be safe and make sure you are kind to other people. And thank you to Keisha. Hey, I appreciate it. Thank you very much. I'll talk to you soon. Bye-bye.